Hi, I'm Dr. Kurt Wohler. The title of this mechanisms video is Cerebellum Peptide Cross-Reactivity with Gliadin Peptides. So this video is sponsored by Integrative Medicine Academy. Integrative Medicine Academy is an online training academy with different courses, what are called mastery courses, in various topics related to functional and integrative medicine. For more information, go to integrativemedicineacademy.com. You can email us at integrativemedicineacademy@gmail.com with any questions. Here is this video disclaimer, understanding that the information within this video is for educational purposes only. So I've discussed in other mechanisms videos some of the concepts of biomedical intervention for autism. And one of the main ones is dietary intervention. So we're just going to take a quick look at that concept. So this was an article that came out a number of years ago. It was actually 2004, so fairly, some time ago. And I was actually part of this article. Now, I was not the lead author. Dr. Aristo Vojani of Immunoscience was. But many of us were involved with regards to this particular paper. Particularly some of the individuals were patients. And so immune response to dietary proteins, gliadin, and cerebellar peptides in children with autism. So what this paper was getting at was that in many individuals with autism, when they had high levels of antibodies, particularly IgG, there was also corresponding levels of IgG activity against cerebellar peptides. And one of the things that exists in autism is that many of these autistic individuals, whether they're children, teenagers, or adults, often have problems in the cerebellum. And so it's a major area of dysfunction within this patient population. So what was analyzed was 50 autistic individuals, 50 neurotypical individuals, and then specifically looking at peptides from gliadin and the cerebellum. And there was a significant percentage of autistic individuals that showed high levels of antibodies to both gliadin and cerebellar peptides simultaneously. So there's some type of cross-reactivity occurring. And that children with autism had significantly higher levels of both gluten and cerebellar peptides in more than 80% of the cases. So as the gluten antibodies or the gliadin antibodies go up, so did the cerebellar peptides. And similar findings were seen with anti-egg and anti-milk antibodies cross-reacting with the cerebellum. Not as high, 68% with egg, 57% with milk. So this is one of the reasons that the gluten casein-free diet is so important, is to remove these foods because they're highly antigenic. We know that milk, for example, is extremely antigenic, but gluten can be problematic as well. So in another mechanisms video, I'd encourage you to watch it, titled "What is the difference between food reactions of IgE, IgG, and intolerance to dairy and gluten?" I go through some different aspects of the difference, again, between an allergy, a sensitivity, and an intolerance. And one of the things that was discussed, and I'm going to discuss it briefly here, was this concept of IgG reactivity to wheat and dairy seen in autism, but also schizophrenia. Now, I'm not showing any information or research on cerebellar peptide reactivity in schizophrenia. I don't have any evidence of that. But what's seen clearly in autism is that these kids often have high IgG reactivity to the food protein. Now that Vojani paper is showing high reactivity to the cerebellum, but they also have high peptides that themselves can trigger immune reactions, but these peptides can also have a drug-like effect. So the peptides actually cross the intestinal lining of the gut. They can cross the blood-brain barrier and interact with opiate receptors in the brain. So they actually affect behavior. They can affect the sensory system. Many of these kids have abnormal pain response. They often have severe constipation, which we know can be induced by opiates. But again, it's more than just an opiate effect, right? Now we've got evidence of IgG reactivity, which can drive immune reactions because elevated IgG, IgM as well, can trigger complement, particularly through the complement, the classic pathway. And so when you do a food IgG profile, like the one from Mosaic Diagnostics, for example, it's not uncommon to see in autistic individuals high reactivity to gluten, to gliadin, to dairy, sometimes even to egg yolk and egg white and other foods. And then remember, anytime we are forming these IgG antibodies or immune complexes, it's possible to actually trigger the classical pathway of the complement cascade, which can drive inflammation. And what's interesting about that C1q you see underlined there was another paper that came out in 2012 that complements C1q formation of immune complexes with milk caseins and wheat glutens is actually seen in schizophrenia. So there's a lot of this kind of research out there. But I wanted to show you that Vajani paper back from 2004, because that's been out there a long time, and that is just one angle of immune reactivity, a cross-reactivity between a food peptide, so gluten, and cerebellar peptides in the brain, knowing that the cerebellum is often compromised in autism. So we discuss this information and more in our Autism Mastery course, which is one of the mastery courses within our academy. You can go to autismmasterycourse.com for more information about this course. And then all of our other courses as well have individual websites, but you can get an overview of those courses by going to integrativemedicineacademy.com website. You can also email us at integrativemedicineacademy@gmail.com. Again, I'm Dr. Kurt Wohler for Integrative Medicine Academy. Thank you.